Thank you for the press for participating in this event. Today at Continental Hospitals is a great milestone that we have created. We are starting a new department of facial aesthetics and craniofacial surgery. And such a department does not exist in any of the hospitals in the region. And this is under the stewardship and directorship of a very famous international surgeon. Very proud for him to be a Hyderabadi, Dr. Srinivas Reddy. Dr. Srinivas Reddy has put the specialty of craniofacial surgery on the international map by his phenomenal and astounding work for the past 3 to 4 decades. So he's performed more than 40,000 surgeries and saving many thousands of unfortunate children and adults with a lot of congenital and acquired craniofacial deformities with innovative techniques. He's also contributed to the world of craniofacial surgery by his own techniques, which have become today, which are being practiced elsewhere in the world. ఈ రోజు మాకు ఒక ప్రౌడ్ మూమెంట్ కాంటినెంటల్ హాస్పిటల్స్లో ఈ హాస్పిటల్లో సుమారుగా 50 స్పెషాలిటీస్ ఉన్నాయి. దాంతోపాటు ఇది కొత్తగా ఈ స్పెషాలిటీ ఫేషియల్ ఎస్థెటిక్ క్రేనియోఫేషియల్ సర్జరీ ఎస్టాబ్లిష్ చేసినందుకు ఒక చైర్మన్గా నేను చాలా గౌరవపడుతున్నాను. ఈ వర్క్షాప్ చేసింది ఎందుకంటే ఇక్కడ ఉన్న ప్రజలకందరికీ డాక్టర్స్కి ఇంట్రడ్యూస్ చేయడానికి ఈ స్పెషాలిటీ వలన ఈ సర్జరీ వలన మనం ఏ పేషెంట్స్కు పిల్లల నుంచి మొదలుకొని పెద్దవారి వరకు వాళ్ళకు పుట్టినప్పటి నుంచి ఈ ఫేషియల్ స్కల్ డిఫార్మిటీస్ ఉన్నప్పటికీ తర్వాత యాక్సిడెంటు లేకుంటే వేరే విధంగా ఈ డిసీజెస్ వచ్చినప్పటికీ అది ఎలా సాల్వ్ చేయాలి. ఈ సర్జరీ చాలా కాంప్లికేటెడ్ సర్జరీ అండ్ సర్జరీ ఇన్వాల్వ్స్ గ్రేట్ టెక్నికల్ స్కిల్. అందరితో చేసే సర్జరీ కాదు ఇది. అందుకొరకే మేము డాక్టర్ గోస్లా శ్రీనివాస్ రెడ్డి గారు మన హైదరాబాద్లో ఆయనకు పెద్ద సంస్థ 25-30 ఏళ్ళ కింద ఏర్పరిచారు. ఎంతోమంది వేలాది మంది చిల్డ్రన్ సర్జరీస్ అని చేశారు. సో ఆయన మా కాంటినెంటల్ హాస్పిటల్స్లో ఇవాళ ఈ డిపార్ట్మెంట్ ఎస్టాబ్లిష్ చేసి దాని డైరెక్టర్గా ఆయన ఈ డిపార్ట్మెంట్ను ముందుకు తీసుకెళ్ళాలి. అండ్ నాట్ ఓన్లీ ఇన్ ఆంధ్రప్రదేశ్ అండ్ తెలంగాణ కాకుండా మన విభిన్న దేశాల నుంచి ఆల్రెడీ హాస్పిటల్లో ఒక నెల నుంచి ఆయన చాలామంది ఇంటర్నేషనల్ పేషెంట్స్కు ఈ సర్జరీ చేసినప్పటికీ వాళ్ళు ఎంతో హ్యాపీనెస్తో ఎన్నో వీడియో రికార్డింగ్స్లో ఆయనకు కాంప్లిమెంట్స్ ఇచ్చారు. సో ఆయనకున్న స్కిల్ సెట్స్ ఆయనతో పాటు డాక్టర్ రవీంద్రన్ గారు ఆయన సింగపూరు కౌలాలంపూర్లో కూడా ఆయన ఈజ్ అనదర్ ఇంటర్నేషనల్ ఫేమస్ సర్జను. ఇద్దరు కలిసి కూడా ఈ డిపార్ట్మెంట్ చాలా ముందుకు తీసుకెళ్తారనేసి అది ప్రజలకు వాళ్ళు ఎక్కడ బయటకు పోకుండా ఇక్కడనే హైదరాబాద్లోనే కాంటినెంటల్ హాస్పిటల్స్కి వచ్చేసి వాళ్ళ హెల్ప్ పొందగలుగుతారని నేను ఆశిస్తున్నాను.
ఒక రూపుదిద్ది ఈరోజు వాళ్ళు ఎంత హ్యాపీగా ఉన్నారో వాళ్ళ ఓన్ వర్డ్స్లో చెప్తారు. ప్లీజ్ యూ కెన్ ఎక్స్ప్లెయిన్ ఇన్ యువర్ ఓన్ వర్డ్స్ how you felt about it.
Hi, my name is Anna and I'm from Continental Hospital with my sister. We've been different countries to check her situation, and this hospital was a very good experience we had, especially Dr. Reddy and everybody here. They was welcoming us and everything was wonderful and the situation was very good, and I'm recommending every patient to come and see Dr. Reddy, and I really appreciate all of you.
కూడా ఇట్లా తిరిగిపోయింది వాటి ఇట్లా షేప్ మొత్తం ఇట్లా అవుట్ అయిపోతే దాన్ని మొత్తం యూజ్ ఏఐ టెక్నాలజీ ఇప్పుడంతా ఆర్టిఫిషియల్ ఇంటెలిజెన్స్ తోటి 3D మోడల్స్ తయారు చేసి ముందే ఆ ఫేస్ మళ్ళీ అంటే వారి యాక్సిడెంట్ కాకుండా పిక్చర్ ఫోటో తీసుకొని దాన్ని మొత్తం మెజర్స్ చేసి తర్వాత మొత్తం మోడల్స్ తయారు చేసి ఆ ఏఐ తోటి మొత్తం ఫేస్ మళ్ళీ నార్మల్గా తీసుకొచ్చాం వారికి. యూ షుడ్ ఎక్స్ప్లెయిన్ వాట్ హ్యాపెండ్.
Yeah, actually, he came from Somalia and he got accidents here. He lost the face, so he get twisted on the face, and actually they did their very bad surgery. And he came here and he met very likely Dr. Reddy. So he did actually diagnostic, and he says he need his fixation on the mouth, and he did actually very beautiful fixation. As you see the patient now, still braces are there, and Soonly he will get removing that and he will eat his mouth. Okay? Usually he can't eat it actually. It's very difficult to eat. Having 2 fingers in his mouth, he can't open it. So now he able to eat juice things because of the face is actually closed and his mouth is closed. I mean, and he can't able to drink. Maybe within a month he will remove all the braces and he can eat normally. Later on, after doing actually the artificial teeth, no one can recognize him. As you see his face now, his face is perfect as he looks now. So I'm appreciating Dr. Gusla Reddy as well, my best friend here, Guru Reddy. Actually, I'm everybody recommended here to come and take a treatment. They care like a family actually. So I can't explain what they have to do already. So thanks to Gusla Reddy and Dr. Guru. So thank you.
Once again. Wait. This transformation surgery antaru. So దీంట్లో we correct the asymmetry. So what we correct is a facial asymmetry here. Now this is the unique department we started in Continental Hospital. It is going to be the center of excellence for all over the world in correction of facial deformity. We are 3 consultant surgeons with 6 fellows with full support team. We have the experience of performing more than functional deviation, TMJ dearrangements, hemimandibular hypertrophy and other pathologies. So how do we treat these asymmetries? It can be classified into 2 components of management, that is for growing children and for the adults. In growing children, we give hybrid functional therapy appliances, or we do a procedure called distraction osteogenesis. And we are proud that we are the first people to perform the first distraction of a mandible in 1998. But sometimes we can do it in one shot.
So one time if you done, it is over.
Yes, it's over. Few of the procedures can be done in one shot, it's over.
Any other questions from the audience?
So, so clarity the topic. That truly is an enormous testimony to the work for the last 3 decades we've done. So my question to you is twofold. Now with the advent of stem cells, tissue growth, use of 3D techniques and everything else, do you think the complexity of these surgeries will reduce, where we can employ these new techniques by injection for the purpose of molding, early healing, those kind of things? Now you also mentioned you have been using the 3D techniques in your place for some time. Are you using just for modeling purpose or using for the purpose of tissue growth then?
We just started the bioprinting now, this year. We have collaborated with a very big lab in Bangalore where they make the bioprinting templates, and then now we are in the process of only doing for the cartilage. Now bioprinting can only happen for cornea, skin and cartilage, because any other organ to do a printing, it needs vascularity. These are the only 3 structures, that is cornea, skin and cartilage do not need any direct blood supply. So they can be grown even in a dish, in a bioprinted model. Whereas 3D printing, 3D developing an organ is still far away for us because we need to create a blood supply for that to go.
On that note, 5 to 6 years ago or 3 to 4 years ago,
I'm an Asymmetry surgeon from Nigeria. And I've always wanted to learn craniofacial surgery as well as plate surgery, because in Nigeria, where I come from, there is not a single craniofacial surgeon. And we're a population of about 230 million people. So I applied for the IAOMS fellowship, which is a very competitive fellowship. And luckily, I got a call and I was chosen for the fellowship. So this is really a very exciting opportunity for me. So sir, for me, it actually falls down to values. I think from what I have seen in just an interaction with for like 2 days with the fellows as well as the children within the Conclave School project, one is able to learn peculiar, humanistic, if English permits me, humanistic values, which I think is portrayed in what you do, sir. And this, apart from being an educational opportunity for me, is also an opportunity. Hopefully, this would be something that we could also emulate within Nigeria. So I'm particularly very positive that this is a great learning opportunity, something that is transferable to us in Nigeria, and hopefully, under your tutelage, sir, I'm hoping to become the first craniofacial surgeon in my country, and also try to push that to other people within Nigeria. Thank you.
I've started my fellowship here since 6 months. So coming to transfer of knowledge, it basically stems from sir and it cascades downwards. His enthusiasm, his approach to patient care, everything is infectious. It keeps transferring to everyone under him. Basically his way of approaching a patient from a holistic point of view. He doesn't just see patient from surgery to surgery. He sees them from a holistic, encompasses all health and general welfare. So starting Pacer, he sees patients right from their birth all the way up to their adulthood. So he has almost 30 years of experience. He's seen children grow from birth to almost 30 years of experience. So he sees them from every aspect of life, every stage of life, and he addresses every single issue that comes up to them. So that care and devotion that he shows patients in a holistic way, that he transfers to us, the fellows, anybody who comes as observers, as our esteemed colleague has come from Nigeria. So everybody gets the same enthusiasm. They pick it up from him, and that basically they transfer to the rest of the world as well. So it's a privilege to learn under him now.
Just like to add that he might shy away from marketing himself, but he's a phenomenal teacher. He has never shied away to pass his knowledge to us. So he has taught almost everything to whosoever comes to him. So all the skills, everything, how he manages by traveling so much, because he has given so much of skills to his students. So every student of his, I would say like maximum 90% of the students, they are owning their own centers. They are doing so well in their life as a surgeon, I would say. So he's a phenomenal teacher, and this is his, that's why everyone from all over the world wants to come and wants to learn from him, because he teaches almost each and everything whatever he knows. He never shied away from passing his knowledge.
I request